Imagine finding a lump or having concerning symptoms and you don't have health insurance or don't have reliable transportation to doctors. Welcome to the Inspired Vitality Show. I'm Catherine. Cancer does not affect all people equally, and today I'm talking about National Minority Cancer Awareness, which is part of National Minority Health Month. Minority cancer awareness is about increasing public understanding of disparities in cancer screening, prevention, and treatment that exist among various ethnic and racial groups. Disparities more often negatively affect racial and ethnic minorities, poor people, sexual and gender minorities, adolescent and young adult populations, and older adults. Black, American Indian, and Alaskan Native communities experience the worst cancer health disparities among racial and ethnic groups in the United States. These populations continue to suffer the greatest rates of cancer and the poorest outcomes for each of the most common types of cancer, despite progress in reducing overall deaths from cancer. Health disparities experienced by racial and ethnic populations is linked to a history of discrimination and systematic exclusion that has prevented communities of color from achieving social and economic well-being. African Americans and other racial and ethnic groups, people who have low incomes or are underinsured or uninsured, and people living in rural areas are often facing greater obstacles than others. Some of these obstacles are racism and other forms of discrimination, poverty, lack of access to affordable, healthy foods, jobs with lower pay, low quality education, and living in low quality housing or unsafe environments. Health equity means that everybody has a fair and just opportunity to prevent, find, treat, and survive cancer. Cancer is hard, and it breaks my heart that it is made harder for some people with obstacles that they face. I realize that simply because of the color of my skin, I may be at an advantage for cancer care, and I can't know how it feels to be a minority. I do, however, have a great deal of compassion for those that are facing the cancer and health disparities. I think it's important that we listen to the experiences and perspectives of all people with cancer, their caregivers, and their communities, and engage them in the fight against cancer every step of the way. We all want to be included, heard, and loved, no matter the situation. I hope if you are a minority watching this video, that you feel my compassion and care through my words. If you would like further information and resources on cancer disparities and health equity, there is a link in the video description of resources and services for specific communities of people with cancer. Please subscribe to my channel if you haven't already, and I'll see you soon.